Hey YouTube, Nurse Leslie here, the Beauty on Duty. Welcome to my channel. Today's video is going to be about different tools and abbreviations that you can use to help you during nursing school as well as in nursing practice. I hope this helps. I'm going to start off with the LPN Welcome and End steps, which I believe is really great for CNAs, nurses, as well as RNs. And you know, you can tailor it to what works best for you. You can tailor it to the protocol for the facility that you work in, and you would tailor it also to the things that are within your scope of practice. So the L in LPN Welcome and End steps stands for look at the physician's orders. You definitely need to know what you're doing. You can't just go into your patient's room oblivious to the situation. Know what you're there for. The P stands for proper protocols for the procedure. This may vary from place to place. This is going to vary from patient to patient in different situations. But you definitely need to know what you're doing, and if you need help, enlist the help of a colleague, a teacher, a doctor, whatever the case may be. The N stands for necessary equipment. You want to bring everything that you need into the room for a procedure. Say if you're doing a Foley cath insertion, definitely have your Foley cath kit there, maybe even an extra just in case you get it in the wrong hole. So we know that can happen sometimes catheterizing female patients. Moving on to the W. The W stands for wash, sanitize, and glove your hands. The E stands for explain the procedure to the patient and reassure the patient. If they seem anxious and nervous, definitely reassure them that you're there for them. Anything that they need, if anything goes wrong, that you're going to be there to help them the best way possible. The L stands for locate the ID band. You want to make sure that you identify your patient, make sure and confirm that you have the right patient, and that you are aware of any allergies that they have. You want to know their DNR status as well, because if you're doing a procedure and they go into a code, you need to know whether you should resuscitate them or not. The C stands for comfortable, efficient position for the nurse as well as for the patient. Using your good body mechanics will definitely help to save your back, reducing muscle strains and things like that, and also allow the patient to be more comfortable. The O is for attain privacy. Definitely make sure that they're covered, modest draping, make sure that the curtains are pulled if they're sharing a room, make sure the door is closed to ensure their privacy from people in the hallway. Next is going to be the M, which is make sure of correct steps, techniques, and body mechanics. And the E stands for ensure safety and observe deviations from normal. So if you're doing a procedure and you notice that their vitals are starting to change, you need to know that. If you are doing an assessment, say, and you notice that maybe your male patient has 3 testicles, or your female patient looks like she has a testicle, like Nurse Steven was talking about his female patient looked like she had a large hairless testicle. Check out Nurse Steven, he's awesome. But it was a really funny occurrence. So you definitely need to know any deviations from normal and write them down. And the end steps are ensure comfort and safety. That's the E. The N is note questions, concerns, and significant data. And then there's 3 Ds. First D, dispose of materials properly. Make sure you have your biohazards in the biohazards, you have your sharps in the sharps, and your regular trash in the regular trash. The second D is going to be to disinfect the area and disinfect your hands. Breaking the chain of infection is very important. We know this because nurses and other hospital staff can easily transmit different bacteria and viruses from patient to patient, and that is definitely not a good idea. The third D is going to be for document and report procedures and findings. Document, document, document. Everything you do, you have to document. I know it can be annoying, it can be tedious, but you definitely need to cover your, okay? So when communicating with physicians, doctors, surgeons, they use something called SBAR. And SBAR stands for, the S is for situation. You want to give objective data. You want to definitely let them know the overall situation without talking too much, without giving insignificant data. You definitely want to give them everything that they're going to need to know without them having to ask too many questions. The B is for background. Give their brief health history as it's related to the reason why you're calling them. A is for assessment, and assessment is not like head to toe assessment. It's more like your diagnosis, what you think is wrong. And then the R in SBAR is for recommendation. What do you think? Do you need a new medication? Do you need an order for a new medication? Do you need an order for testing? So SBAR is really cool. It takes some practice to get used to and to really master it, but we've got all the time during nursing school to master those things. And the next thing is going to be OLDCART, which is really great for pain assessment. The O is for onset. When did it start? The L is for location. Where does it hurt? Have them point to it. And if it's not something where you can actually point, just give a general area. It kind of hurts all right here. Okay, so then you have an idea it's a headache. The D is for duration. How long does it last? The C is for characteristics. Is it a throbbing pain? Is it a stabbing pain? Is it a referring pain? Does it go from your neck, shoot down to your arm, down to your foot? You know, what's going on? What are the characteristics? The A is for aggravating factors. What makes it worse? Well, don't do that, you know, but maybe you can avoid walking. Maybe walking makes leg pain worse, so you need to know that. What makes it better? When you get off your feet, maybe that makes it better, but it's not always possible. But it helps with the assessment to know these things. The R is for relieving factors. The T is for treatment, pharmacological or non-pharmacological methods. Whether you've got massage, whether you're taking herbs, whether you're taking medication, we need to know these things before we give them anything else, because we know some herbs can, interact. They can interact with different pharmacological drugs. So these are very, very important, and when you're making report, there are certain things that you have to do. You have to, number one, make it quick, to the point. You have to give objective data. If there's something that's not within normal limits for your patient, definitely give those numbers. For instance, if you take a blood pressure and the person's blood pressure is 200 systolic over 130 diastolic, and you just go and tell the doctor, oh, well, his blood pressure was really high. Well, of course they're going to ask you, what was the blood pressure measurement? So just give it, and they don't have to ask questions. Give safety tips. If your patient is a biter, let the person know that they need to watch out for this person because they bite. If they kick, let them know. Use the correct terminology. Don't start, throwing in LOLs, OMGs, and things like that. Use proper abbreviations and use the proper medical terminology. We're professionals now. We're nurses now. There's no pussy secretions. They're purulent exudates, things like that. You want to be professional. Even though you may be very friendly with your colleagues, you can't act like your friends in the hospital. You have to stay professional, because when you're being too lax, maybe you start to leave important things out. So just be professional. Speak clearly, speak slowly. If the person may be from a different country and they can't understand when you speak very, very fast, so try to slow it down just a little bit. Not down to dummy level, you don't want to offend anyone, but speak slow enough so they can understand. And be organized. And this has been a challenge for most of my classmates during nursing schools, to cluster the information. Don't go from meds to vitals to assessments. Have all your meds in one section, all your assessments in another section, and so forth. So keep it all together, because when you're bouncing around, people get confused sometimes. So I hope these tips help. If you have any questions, please let me know. Thank you so much for watching, and I will see you on the next video. Bye-bye.